Tomorrow is St. Patrick's Day, but you don't need the luck of the Irish to have a smile that is as bright as when Irish eyes are smiling. Dentist Steve Marsh is here with ways to brighten your smile, no matter whether you're a lassie or a laddie, and that's no blarney. So welcome to the show.
Well, thank you, and your producer came up with quite a cute introduction.
Yeah, this pre-St. Patrick's Day. Now, green teeth don't really get involved in the wearing of the green, right?
No, and it's funny, your last patient was talking about green tea and things like that, but oftentimes people get teeth stained because of sometimes it's food and debris. Recently I had a patient who came in, she was unhappy with the color of her teeth. We ended up doing porcelain veneers, so we've got a beautiful smile, and we can demonstrate that
very
later.
Happy then.
Very happy, but it turned out that she was a juicer. You mentioned these healthy things, so she drank this very green juice, and as a result her teeth got stained very badly.
Oh dear.
And so now she comes in every couple months to get her teeth cleaned, because we can do a better job at taking off the stain. And that's the picture of her. That was her before. That was her after veneers. She could have had a bigger smile, and you see the change in lipstick and color with different camera. But in any case, we use porcelain veneers. But again, even with porcelain veneers, it's like a piece of china that you eat off of. You can stain it with different foods and things like that.
Wow, so what we eat and what we drink can stain our teeth. So what do we do?
Well, when you have those extrinsic stains that you just talked about, that's where you go to the dentist, as she does. And I'm going to point this out, Lori. We have two different pumices or cleaning things in our office. One is the abrasive one, and most people will use that, and most hygienists use it. It gets stained off beautifully. But if you've had bonding or veneers like she had, there's one a paste that's made specifically for crowns and veneers, and it doesn't take off the glaze. In the same way you wouldn't use soft scrub or Comet on a piece of china.
Ooh, yeah.
So in those cases, the hygienist should know which one to use for bonding and crowns.
Okay, get your teeth clean again. But I know that there are some people who have yellowing teeth. They don't drink the coffee in the tea. So
right.
what's
and I have
going
some
on
pictures
there?
of that. And some of the patients, some of it is just with age. You know, as our viewers get older, sometimes you get a stain like this. And in fact, she came to me because her grandchild talked to her about the stain of her teeth. A lot of coffee, a lot of tea. Here's a patient who had fairly yellow teeth, and when they did her crowns a number of years ago, and those are crowns on the front too, they made them yellow to match the others. Today what we'll do is whitening. And this is an interesting case. He came to me from Columbus. He had had tetracycline stains, and that happens when a child is developing either in the mother's womb or just in their first year or so, and the teeth are developing. They sometimes use tetracycline, and somebody had tried to cover that with bonding, and it looked very artificial. He was very unhappy, and he ended up coming to me and saying, what can we do for that?
So the tetracycline, that's inside. So
that's
they can
within.
be outside stains, inside stains, but there's things that can be done.
Absolutely. And so what we look at is cleaning and that sort of thing. And I thought what we would do is show the same pictures of those people who came to me with those three circumstances and how we rectified that. And so as we bring those pictures up, you can see what happened. I mentioned the woman, the grandmother, who came in with the stained teeth. Initially, Lori, we did whitening. We did it with Zoom, which takes about an hour and a half. It helped, but because she drinks so much coffee and tea, it didn't take care of the whole problem. And so we ended up using porcelain veneers. That's what we did. We extended those all the way back. I also mentioned the woman with yellow teeth, and you mentioned about intrinsic stain. As we get older, we brush some of the enamel off, and so the layer underneath can be very yellow. And in some cases, it can be we have a natural color tendency to a yellow or white, and everybody has a little difference. She's fair-skinned, so the yellow really sticks out. We took off some of those yellow crowns. We did porcelain veneers, and she said, while we're doing it, let's make them as white as we can and extend that to the back. That's how we took care of that. We mentioned the third patient who came from Columbus. You can see that he had old bonding on the top, dark stained teeth. That's again tetracycline on the bottom. We did porcelain veneers. We did some gum contouring to give him that bright smile that he's always wanted. They look certainly much more natural than the old bonding. So there are different techniques that dentists can use to counter the color of your teeth, whether it's the green St. Patrick's Day or a yellow.
All right, great information as always. So if you're saying Irish, you know, I wish I had a beautiful smile. Today is your lucky day. Just give Steve a call and he'll help your teeth look their best and their brightest. His number's coming up next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, get straightened out.